Okay.
Bismillahirrahmanirrahim. Respected teacher, dear fellows, Assalamu alaikum. काम क्यों नहीं कर रहा? Bismillahirrahmanirrahim, starting with the name of Allah, the most merciful and almighty. Respected teacher, dear fellows, Assalamu alaikum. My name is Muhammad Noman, and today my presentation topic is biological hazards in the workplace. Our objective for today's presentation is we will discuss what are pathogens, type of pathogens, which are virus and bacteria, blood-borne pathogens are diseases, and types of diseases, which are acute and chronic. Pathogen. Let's discuss what are pathogen. Pathogen is a biological agent, microorganism that cause disease or illness to the host. Host is a human body, such as virus or bacteria. So let's discuss the difference between these two agents. First of all, let's discuss bacteria. Bacteria is a single cell independent organism. By independent, we mean they do not need a host to reproduce. They can reproduce by their own. Can survive and multiply outside the host in the right environment. Occupational hazards include occupational risks include Legionella, which cause Legionnaire's disease, and Leptospira, which cause Weir's disease. Sorry for the slides being printed wrong. Now we come toward a virus. Virus is smaller than bacteria and require a living host to replicate. They cannot reproduce by themselves. They will first infect a human body or a different kind of organism to reproduce and increase in number. This cannot be treated with antibiotics like bacteria, but we can use vaccine to prepare ourselves for such infections. Occupational risks include hepatitis B, HIV, or influenza. Now let's discuss blood-borne pathogens. What are blood-borne pathogens? Microorganisms in human blood that can cause disease in humans. Such pathogens are called blood-borne pathogens. The primary hazards includes hepatitis B, which is caused by hepatitis B virus. High survival rate on surface preventable by vaccine. Hepatitis C, which is caused by hepatitis C virus, often lead to chronic liver disease. No vaccine, but can be healed with modern medication. HIV, which cause AIDS in human being. It is
HIV means human immune deficiency virus. What is stand for HIV? Human immune. Immune is our protective system. Deficiency virus, which affect your inside immunity when it is affected. And mostly, he will explain you why HIV is there.
HIV can be occur by accidental puncture, by needle or sharp object, or by any bodily fluid by infected person.
Especially through the sexual transmission. Is it okay? This is one of the major sources of the HIV.
HIV causes AIDS. AIDS is acquired immunodeficiency syndrome. This is the name of disease which HIV can cause. The routes of transmission include accidental inoculation. Inoculation means to introduce.
Right.
So it can be introduced accidentally by using razor and from infected person or needle from infected person, splashes to eye, nose or mouth, or contact with broken skin.
Yes. I already told you recent data of our Pakistan, especially in Islamabad, in Peshawar, okay, the HIV/AIDS virus is on very big rise. So mostly, what are the root causes? As he discussed, sometimes the needle stick injuries. You didn't protect yourself from the needle, which is infected by the other person blood or fluid. Similarly, the blades, especially the barber shops, you know about it. We are there going for our hair cutting or shave, and if the barber cutting equipment is not properly sterilized, so it may have the HIV/AIDS virus. And if that contaminated blood come into inside your body, what are the contact point inside our body for the collection from other person? That is what the main thing is skin, through skin contact. The other thing is what the blood of the other person, which maybe go inside our skin due to the absorption or due to the needle stick injury. Similarly, if the fluid, like the fluid of one person, like a saliva, pus of the person, blood of the person, is go inside any fluid and you take that fluid inside your body, like sometimes the blood of the other body or fluid inside went to or go to inside your eyes, so that will be transmitted to your body also. So very, very important is now, as by definition Mr. Noman told you, that mostly bacterial can be treated by antibacterial. But you cannot treat virus most, like COVID-19. You remember the COVID-19?
Yes, sir.
Okay, coronavirus. So mostly when a virus is occurred, mostly the prevention is the cure is not possible. So you have to prevent yourself from the person, other body person, fluid or etc. Yes, you can continue.
Thank you, sir.
Noman.
Now let's discuss the difference between acute and chronic diseases. What are acute disease and what are chronic disease? Sir, this slide is a bit messed up.
No issue. Okay.
The chronic disease cannot be shown. Sir, lower the font size of the entire slide. A little bit more, sir.
Is it okay now?
Yes. Acute disease. Acute disease are sudden onset following a single high level exposure. It can happen on the spot. It doesn't need a long time or duration. Symptoms appear almost immediately, like vomiting from salmonella. Salmonella is a type of bacteria. Or lung irritants from chlorine. Outcomes include usually result in recovery or immediate crisis. It can be recovered immediately or can cause a fatal injury or uncurable crisis. Chronic diseases include slow, insidious development over a long period of time. Insidious mean gradual with time. Causes include repeated low level exposure over months or years. The outcome is permanent or progressive, like tuberculosis or hepatitis C. Now, the control measure for biological hazards are of three types. First, let's discuss the universal precautions. The standard of treating all human blood and body fluid as if they are infected. We will always think like everyone is infected and we will keep yourself safe from their bodily fluid. Engineer control. Engineer control include functional resistance like sharp containers. We should avoid sharp containers, lifting or any kind of dealing. Effective ventilation and LEV in laboratories.
Very good.
LEV include local
Local exhaust.
exhaust ventilation.
Like you see in your kitchen, in your home, there is a hood, okay, outside of your stove, you know. So it directly, okay, exhausts the fume from or dust from your kitchen to the outside. Similarly, LEV system is for the dust where machinery is working. We put an LEV system over there, and automatically the dust particle not flowing inside all of the hall. It is collected from one point and went outside through the LEV system. If you check in your book, there is a LV system picture also included. You can see the book for LV system. Yes, please continue.
So the administrative control include vaccination, which is mandatory for hepatitis B program for high-risk staff, hygiene, rigorous hand washing protocols, and decontamination. We can use the third control as PPE, use of gloves, masks,
The last
aprons,
option
and
remain is PPEs. Like in coronavirus, no other option was there. So we were wearing gloves, you see, if you remember, and we are wearing masks. Because sometimes, if the person have that serious kind of virus and he is talking and he's spitting out of the come of his mouth, sometimes it is also flowing in the ear. So it can be go inside the other body person. So for this purpose, we use mask, we use gloves. So our virus is not converted to any other person. Is it okay now? Yes. Good. Yes, please.
now the emergency force exposure protocols. Immediate action include decontamination, like wound care. In case of wound care, encourage bleeding under running water. Do not suck or scrub the wound. Wash. Use warm water and liquid soap. Avoid harsh chemical or bleach splashes. Flush eye or mouth extensively with sterile water or saline. Medical intervention include urgent referral. Move to an occupational health specialist or emergency room immediately. PPE window. This is the window where you can start the post-exposure prophylaxis within 1 to 2 hours for maximum effectiveness. Investigation and review. Reporting, record the accident book and notify regulators if legally required. Root cause, identify if the failure was due to equipment failure or
Other any cause. Okay.
any cause. Sir, I cannot see the remaining slide.
You can continue. Okay. Thank you. Very important presentation presented to you by Mr. Rahman. Thank you. Very good. The presentation he made is excellent. Delivery was excellent. Okay. So I hope so. Now you know the importance of bloodborne viruses. So we have all ourselves to protect, especially the workers also. If you are in the site and anyone report to you about any person, you are going to outside for the job, especially for UAE, Gulf, etc. So there will be a medical checkup of you. So if a worker is medically fit and he is working over there, you have to again give him medical treatment if you found he has some of a disease. And also you have to conduct after 1 year's screening of for it, which is called health surveillance. You have to check especially those who are working in the laboratories in the serious areas. So you have to check if you found that worker, you have to take immediate action. And for you all and we must do proper vaccination, especially for hepatitis B. The vaccination is available, although it is a little bit costly. But if you use that vaccination for your body, so you will be protected about 5 years for the next. And hepatitis B and C are the silent killer in Pakistan. Mostly we didn't check our hepatitis B and C status, and when it is diagnosed, as you discussed, acute effect, chronic effect. So sometimes it is diagnosis, the effect is chronic, which may not be reversible. Is it okay now? So next, please. Whose presentation?
Assalamualaikum warahmatullahi wabarakatuh.
Walaikum assalam.
Today my topic farms classification and health risks from hazardous substance. Forms of chemical agents.
Good.
Physical form, solid, dust, famous gas, mist, vapor, liquid, and fibers. Keep in mind the physical form greatly affect the hazard presented and the roads of entry into the body. Fungi, farmers, lungs, bacteria,
Legionnaires disease.
legionnaire disease, and leptospirosis.
Good.
Virus, HIV, and hepatitis B. Acute and chronic health effects. Acute, short-term effect, a high level of exposure,
Good.
short exposure time,
Good.
quick effect, e.g. exposure to high concentration of chronic gas. Chronic long-term effect, lower level of exposure, long exposure time, multiple exposure. Multiple exposure to asbestos. Classification of chemical hazard to health. Physicochemical effect, e.g. highly flammable, e.g. explosive and oxidizing. Health effects, e.g. toxic and carcinogenics.
Good.
Environmental effects, harmful to aquatic life.
Okay, the sea life. There are some animals are there inside the sea. So if you affect your sea level, water level, so it is also affected the inside living organism over here.
Classification of chemical hazards to health. Acute toxicity, small doses cause death or serious illness.
Very good.
Skin corrosion,
Corrosion
or irritation.
to your serious eye damage to eye irritation due to the corrosion or inflammation.
Serious eye damage in eye or eye irritation destroys eye tissue or causes inflammation.
Good.
Respiratory or skin sensitization causes asthma or allergic dermatitis.
Good.
Germ cell mutagenicity causes hereditary genetic mutation.
Good.
Carcinogenicity causes cancer.
Good.
Reproductive toxicity causes sterility or is harmful to unborn child.
Unborn child. Good.
Specific target organ toxicity cause damage to specific body organs. Aspiration hazard harmful if inhaled into the lungs. Sensitizing agents and dermatitis. Sensitizing agents in chemicals respiratory sensitizer causes occupational asthma, e.g. floor dust, isocyanate. Skin sensitizers cause allergic dermatitis, e.g. epoxy resin.
Good.
Dermatitis, non-infectious skin condition where the skin become dry, flaky, cracked and painful.
Very good.
Primary contact dermatitis, skin reacts at point of contact only, remove agent and skin recovers.
Good.
Allergic or secondary contact dermatitis, sensitization, reaction, dermatitis all over skin. Summary key talk away.
Good.
Chemical agent exist in many forms.
Good.
Solid, dust, fumes, gas, mist, vapor, liquid, and fibers.
Good.
Number 2, biological agent include fungi, bacteria, and virus.
Good.
Acute effect, short term, high exposure, chronic effect, long term, repeated exposure. Some substance cause both acute and chronic effect, e.g. organic solvent.
Good.
CLP regulation classifies chemical by physicochemical, health, and environmental effect.
Good.
Health classification include toxicity, corrosion, carcinogenicity,
Good.
mutagenicity, and reproductive toxicity, and more.
Very good.
Sensitizing agent cause asthma or dermatitis. Dermatitis can be primary or allergic. Okay. Thank you, sir.
Good. So, Mr. Suleiman presented you a very important topic: classification, forms, and health risk of different kind of hazardous substances. Very, very important. As a safety professional, you must face different type of chemical in the site, and the different form of the chemical. Like you must know about solid, about dust, about fume, gas, mist, vapor, and liquid and fiber. Generally, you see, we sometimes say, okay, the petroleum fumes. Now, by definition, if you go to the definition, you will find that fume are metallic particle, which is mostly produced by grinding or etc. Is it okay now? Is it okay now? So, whenever you are there and you found any kind of substance in different form. So, most of all, you know what is the form of that agent. It is in vapor form, it is in fume form, okay, it is in the dust form. According to the requirement, you have to take protective measure. And keep remember, never ever allow the chemical in your workplace in an unsafe area, unsafe zone. Where we have to put the chemicals? In which area? The classified area, which is solely, the chemical area, which will be restricted. And if a chemical is using in a site, okay, what you have to do? You have to do properly check according to the requirement. What are the protective measure or preventive measure for it? And chemical can be, in the next slide we will learn, you can check the chemical. Sometime, they are putting the chemical in like, in our country, they are putting in the like Pepsi or Sprite, okay, cold drinks bottles. It should not or never be allowed. Chemical should be in the designated area, in the designated container or bottle, where label should be there. And also you have to check the MSDS for it, material safety data sheet, that it is available or not. Because if, like in our country, we are using very frequently, our kids are using Elfie. You know about Elfie? What is Elfie? We are using it at our home. But no one know about its MSDS, because MSDS is mostly not there with Elfie. So you are using it, and if unfortunately, if go inside, like in a sensitive area, like in your eyes, your throat, or your ears, so what will happen due to the Elfie? So this is why it is important that all chemicals should be stored and used by authorized person in a safe area and the proper requirement. Even in the outside world, for a chemical substance to use, you must have a proper authority letter. Even by purchasing, like in our country, people are using battery acids, and everyone taking acids to their home. But no certain strict requirements are there. So why? You see, if you not know, so many people got injured due to the acids. And sometimes they also drinking it due to the ingestion. So very, very important topic. I hope check a medical store. So many medicines are there. Why they are different from each other? Because there are chemical compositions change from each other. And there are two important programs. Okay, write down this program. If you want to learn about the chemical more, the UK program is COSH, COSHH. If you want to know about the chemical, write down the program for the chemical, COSHH. What do you mean by COSHH? Control of hazardous substance, control of substances hazardous to health. This is the form of COSH. And if you want to go for a UK program for chemicals, the program name is HAZCOM. HAZCOM. What do you mean by HAZCOM? Hazard Communication, which is USA program for the chemical.